Welcome to Unicate Talks, where science and public health meet your everyday world. In this episode titled Osteoarthritis Relief Moving Beyond Medication, we're diving into the powerful world of non-drug therapies for knee osteoarthritis. It's a condition affecting millions, yet many are still relying heavily on medication when new evidence is showing that simple, non-invasive options may be just as effective, if not more. Today, we'll explore those options, the science behind them, and what it means for anyone living with chronic joint pain. Knee osteoarthritis is not a rare condition. It affects people across the world, from older adults to former athletes, and even younger individuals recovering from injury. Its impact can be serious: pain, stiffness, reduced mobility, and a loss of independence over time. Most are familiar with the traditional treatment approach: anti-inflammatory medication, regular painkillers, and in some cases joint injections. But the side effects of long-term drug use, stomach problems, heart risks, or reduced effectiveness have prompted the medical community to look for safer, longer-lasting solutions. Recently, researchers reviewed data from nearly 140 clinical trials involving almost 10,000 patients with knee osteoarthritis. Their goal? To compare different non-drug therapies and see which ones truly work. Out of all the interventions, one came out on top: knee braces. These simple wearable supports work by reducing pressure on the knee joint, improving alignment, and helping users move with less pain and greater stability. They are affordable, easy to use, and unlike most medications, they come with minimal risks. Following close behind were water-based therapies. Hydrotherapy, also known as aquatic exercise, showed significant benefits, especially for pain at rest. Why? Because water supports body weight, reducing the pressure on the knee while still allowing for movement and muscle activation. This gentle form of therapy not only reduces pain, but also helps rebuild confidence in joint movement, especially for those who struggle with land-based exercise. Exercise itself, done consistently and with proper guidance, was also a clear winner. Structured routines that include strength training, stretching, and aerobic activity helped patients improve function and reduce pain. Strong muscles around the knee joint protect the cartilage, improve joint stability, and slow the progression of osteoarthritis. Exercise also boosts blood flow, supports mental well-being, and contributes to better sleep, all of which affect pain perception. Interestingly, some therapies that are often marketed as cutting-edge, such as laser treatment, shockwave therapy, and ultrasound, showed much weaker evidence. They might provide temporary relief for a small number of individuals, but across large groups, their benefits weren't consistent or strong. That doesn't mean they're completely ineffective, but if you're looking for reliable first-line options, braces, hydrotherapy, and exercise are the ones backed by the most convincing science. This emerging research confirms what many in holistic and integrative health have supported for years. Movement, support, and self-care are powerful tools in managing chronic joint conditions. What's especially important is that these therapies can be used together. A person wearing a knee brace who also does regular pull therapy and strength training is likely to see far better results than with one method alone. And none of these interventions carry the long-term risks of regular pain medication. The shift in thinking is both scientific and practical. Healthcare professionals are starting to move away from medication-first models, especially in chronic conditions that respond well to physical therapies. And for patients, this offers more control, fewer side effects, and the possibility of improving their quality of life in a sustainable way. This is not just about short-term pain relief, it's about building strength, restoring movement, and preventing further decline. At Unicate College, we believe that science should always support the safest and most effective path forward. Our courses in health science, movement therapy, and botanical medicine are rooted in real-world evidence, designed to equip future practitioners with the tools they need to guide recovery, not just manage symptoms. Whether you're a student, a professional, or simply someone eager to learn how the body heals, our flexible, accredited programs can help you make a difference. Thank you for listening to this episode of Unicate Talks. Until next time, keep moving, keep learning, and keep looking beyond. We extend our sincere thanks to Dr. Watkis for his expert insight and thoughtful guidance throughout the development of this episode. His contribution as a doctor of botanical medicine was instrumental in shaping the content and direction of this discussion.